I am here with Dr. Jason Lowenstein at Atlantic Health, home of Atlantic Sports Health, and we're talking about spine health here today and talking about different spinal injuries that young athletes get and adults may even occur.
Sure.
So when we talk about spondylolisthesis and spondylolysis, we went over those in our segment. What are ways we can really address these early on?
Yeah, I mean, oftentimes this is a spectrum where it starts off with a small stress fracture, which can become a chronic stress fracture or actually a slippage, that's spondylolisthesis. And early diagnosis is so important because this is one of these problems that if you catch it early and you treat it appropriately, it can be treated effectively and really allow these athletes can go on to have completely normal, pain-free careers. But if we can catch it early, it's really important. So usually, when a child has recurrent pain, the first thing we do is we examine them. We see if there's any changes in their normal physical examination which suggest that they might have a stress fracture or a spondylolysis. Pain on extension is oftentimes a telltale sign, and it's because that repetitive hyperextension is what causes it. They oftentimes will get hamstring tightness too because the L5 nerve root oftentimes is very irritated from the fracture, and that can cause hamstring tightness. And if we're suspicious and we think that they have a stress fracture, the first thing we'll do is order an X-ray. And we'll get a simple X-ray to try to see, is there a mechanical stress fracture that we can see on X-ray? If the X-ray is not conclusive, if we can't tell based on the X-ray, but we're still very suspicious, we'll order an MRI. And an MRI is a great, safe study. There's no radiation. An MRI is just simply a big magnet. But it'll let us see them on the inside, and we can actually see if there's a stress fracture. There's several other tests we can get. A bone scan is one where basically you're looking for blood flow. And if you have a stress fracture, the body's trying to usually fix that by increasing blood flow to that area to get it to heal.
Interesting.
So bone scan's an option. Rarely, if we can't tell, sometimes we'll get a CAT scan. If it's an older fracture or chronic fracture, sometimes the MRI and bone scan will be negative, but we'll get a CAT scan because we want to see the bone quality a little better.
Wow. So you have a real progression to help diagnose if someone has pain, but things keep coming up negative.
Yeah, absolutely.
And the pain persists. I mean, what a great pathway that you take your patients down here.
Yeah.
And I find it really fascinating how you go down that road and you can take a bone scan and see if there's blood flow. Would that also identify a stress reaction?
Absolutely.
It would. I mean, can you explain a stress reaction opposed to a stress fracture?
Yeah, sometimes you can start seeing changes in the bone. So early on, when the bone is being stressed, before it actually cracks, your body will try to heal that by increasing blood flow to that area, which is why it would be picked up on a bone scan. So, and an MRI oftentimes will pick it up too.
Yeah, I mean, that's really cutting edge. I mean, because you're getting to the patient and identifying, hey, there's something going on here. You have a stress reaction, not a fracture yet, but there's stress here being placed on this due to improper movement or overextension, and you can identify and get to it before something bad happens.
And then the real value is trying to make a change to prevent it from becoming a true fracture. So if you can identify it early and you can change their behavior or change how they're working out, or you can oftentimes prevent having the fracture.
It's the magic, change behavior. I know I'm speaking to the choir. We want to. I know parents are always trying to change behavior, get off the electronics, get off this, get off that. But maybe we'll change it to keep that back healthy and keep those spines working the right way.
It's great.
So much. Thank you so much for the information. Really cutting edge here at Atlantic Health with Dr. Lowenstein talking about spine health. Take advantage of this information, apply it, and guess what? You're going to take your game to the next level.